Hello, my name is Katie and I'm a level 1 nursing student. My clinical instructor has assigned me to observe you today.
Excellent. Feel free to ask any questions you might have.
Thank you so much. I look forward to learning a lot. So you're taking care of the patient in what room was it? 621? Did I get that right?
I'm pretty sure it was 619, I think.
619. Thank you. Do you have time to give me a report?
Yeah, of course. So we're taking care of patient Greg Lutz. He is a 67-year-old male. He is currently a full code. He weighs 171 pounds. He's 5 feet tall and 11 inches. He currently has no known allergies. He has type 1 diabetes. He was presented to the hospital complaining of increased blood glucose readings for the past 5 days now, with results in about the 300s. And he also has a non-healing wound on his right heel that he noticed about 3 weeks ago. He's had type 1 diabetes for about 20 years now, and 3 weeks ago he had glucose running in about the 120s, so we want to get him back in that range. His last A1C was about 3 months ago at 5.2%, so that's good because for diabetics we want their A1C to be less than 7%. The patient admits to tingling in the bilateral lower extremities, which has worsened in the past 3 months. The patient has qualitative deficits in being able to identify sensations with a pinprick to the bilateral lower extremities. After giving him morphine because of his pain is now currently at a 1 on a pain scale of 0 to 10. His diet, the patient currently followed the American Diabetic Association diet, but he's been having decreased adherence over the past 9 months, and he would like education on diabetic diet. He has a stage 2 diabetic ulcer on the lateral aspect of his right heel. The patient noticed that the heel wasn't, the lesion on his heel wasn't healing, and it's becoming more painful. So that's one reason why he's in the hospital right now. The wound is 5.5 centimeters and 2.5 centimeters at the largest diameter and about 3 centimeters deep, exceeding into the dermis. The wound base is pink with moderate serosanguinous exudate. The vitals were all taken at 16:45, and they were all within normal range, so that's good. The weight has been good at 170. He has an IV site in his right median vein, forearm, dated Tuesday, which is today, 16:45, so that's good. But his last glucose reading was taken a few minutes ago, actually, at 20:30, and his glucose was at 242. So that means right now we're going to be giving NPH mixed with regular insulin, 50/50 at 2100, which is 9 p.m. Basically, our plan of care with this patient is going to be glucose control. We're going to want to teach them about their diabetes, how to manage diabetes, pain management for the ulcer that he has, and then wound evaluation and care.
Thank you so much for giving me a report. Do you mind if I ask you a couple questions regarding the medication administration, then watch you demonstrate giving the medication in the patient's room?
No problem at all. What questions do you have?
Why specifically is the client receiving this medication?
This patient is receiving this medication because he has type 1 diabetes. So basically, his pancreas has beta cells, and those beta cells aren't producing insulin. So that means the glucose can't go into the cell, so he doesn't have energy. So he's going to need insulin for the rest of his life.
Thank you. What action does the medication have on the body?
The action that this medication has is it's going to decrease the blood glucose by stimulating glucose uptake in the skeletal muscle and fat, and this also stops the hepatic glucose production.
Thank you. When should you question administering this medication?
I'm going to question administering this medication if this patient has any allergies to the medication, if his blood glucose is less than 70, or if he has any side effects of hypoglycemia, such as if he has pale skin, coolness, tremors, anything like that. I'm not going to want to administer it if it's not the right patient. If he doesn't have food in front of him, I'm not going to want to administer it either.
And does this medication have a therapeutic serum level?
No, this medication does not have a therapeutic serum level. That's more for other kinds of medications that aren't made in the body, because insulin's made in the body. But one thing that can regulate insulin is to check the glucose, which is normally between 70 and 120. And then also to check the A1C levels, which you want less than 7%.
Okay. Which vital signs must be monitored?
I would do a baseline of all vital signs, such as respirations, heart rate, blood pressure, which all of his were normal, which is good. You're going to want to check his pain. You're also going to want to check the weight, because if his weight fluctuates, then you're going to have to change the dosage of the insulin.
Which physiological parameters should be monitored when the medication is being administered?
Going into the patient's room administering insulin, you're going to want to make sure your patient doesn't look pale, he doesn't have tremors, it's not cool to touch, he's not sweating, anything that's a sign of hypoglycemia, because if you give them insulin when their blood sugar is already low, it's just going to drop even more, which is really bad. So you're not going to want to do that at all. So that's one thing you're going to want to look out for. Definitely going to want to look out for allergies. That's a big thing. Make sure they have food present, things like that.
Awesome. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
In the hospital setting, I'm going to want to teach them signs and symptoms of hypoglycemia and hyperglycemia. And if they have any of those signs and symptoms, to call me immediately and let me know. I'm going to want to teach them side effects of the medication, such as redness and itching at the insertion site, things like that, to let me know about them, about how it's important to rotate injection sites, not to just always do it in the arm, to rotate. And yeah, that's it.
All right. Which interventions must be taught for taking the medication safely at home this time?
And then at home, I would want to teach them the same things. They need to know the signs and symptoms of hypo and hyperglycemia, rotating injection sites. I'm also going to want to teach them to keep 15 grams of a carb with them, especially when they're exercising. Also, when they have a low blood sugar, what kind of foods do they eat? I'm going to want them to eat juices like apple juice, orange juice, or a hard candy. Then wait 15 minutes and check their blood glucose again. This is called the 15-minute rule, and they do this 3 times. If their blood glucose hasn't gone back to normal, to definitely call a doctor. To always have an ID band or an identification card in their wallet that identifies that they have diabetes. And to also store their insulin away from... Oh, okay, is the computer okay? Okay.
Yeah, I just wanted to stop it. Sorry, continue.
No, you're okay. And to also make sure they store the insulin out of the sun.
Very good, thank you. Now, what are the side effects and potential adverse reactions?
Some side effects are definitely any kind of allergic reactions at all, if they're allergic to the medication. And also it can have also hypo and hyperglycemia. And also they can have redness, itching, erythema at the injection site.
Thank you. How will you know this medication is effective?
I'll know this medication is effective if they don't have any signs and symptoms of hypo or hyperglycemia, and if their blood glucose is in an effective range in the 70 to 120, or if at least their blood glucose has gone down.
Okay. Oh, your turn.
Oh, okay. Any more questions for me before we go in the room and administer the patient their medication?
No, thank you so much for answering my questions.
Not a problem at all. It is important to know your patient and the medication you're administering to keep your patient safe. Okay. So now I'm just going to go on to my MAR. I'm going to go onto my MAR and look up my medication, and I'm giving MPH, regular insulin, 50/50, Humulin, 50/50. So this is an intermediate insulin mixed with a short-term insulin. So that's right here. So I'm going to do my first check. So I have the right medication, insulin, MPH, regular insulin 50/50, Humulin 50/50. And then I have the right patient, Reg Lutz. I'm giving 20 units at 2100, the right time. The route is going to be sub-Q and hopefully the abdominum, but I'm going to check where his last rotation was. And then also, yeah, so that's it. So that's good. So I'm just going to, and also I'm going to want to rotate this in my hands because you can see it's cloudy.
Oh, I see.
Yeah,
That's cool.
because their two are mixed. It's pre-mixed.
Rotate it. Okay.
Yeah. I'm just going to wash my hands. And because we're giving 20 units, I'm going to want to draw up 20 units of air before. I'm just going to put on some gloves. Here.
Are you all out? No, yeah.
I only have 2 more gloves here. I'll just reuse these.
They're sometimes hard to get on.
Yeah. Okay. So I'm going to make sure I want to clean the top of this with an alcohol swipe. Throw that out.
Can I see that?
Oh, yeah.
Oh, it doesn't matter. Just asking.
And then uncap this. Do 20 units of air. And then also I'm going to want to check the expiration date on this insulin, and we're good to go. It is not expired. So I have 20 units of air that I pushed in, and I'm just going to insert the 20 units of air, push it upside down, and then draw up the 20 units of insulin. Okay. And then usually in the hospital we like double check with someone else on the reading. So can you just double check with me that that's
Yep,
20?
20
Okay.
units.
20
Of
units.
NPH.
Alright. And then also, when you're recapping, you want to put one hand behind your back, just like that, to recap it before going into the patient's room. Because this protects you as a nurse. You don't want to stick yourself, so just using one hand is much more safer.
Okay, thank you. I didn't know
Yeah,
that.
you're welcome. So then now where I'm going to do my second check, I'm going to bring out the doctor's orders and compare the doctor's orders against the MAR and make sure I have, so let's see, I have the right patient, which is Greg Lutz, that's correct. I'm giving MPH mixed with regular insulin 50/50, Humulin 50/50, so that's correct. I'm giving 20 units at 2100, sub-Q in the abdominal. So that's all correct. Good to go. I'm going to take off these gloves. Wash my hands. Alright, so now that I've done my 2 checks of my medication outside of the patient's room, I have my medication set up for the administration. Now I'm going to go inside the patient's room. I'm just going to knock. Knock, 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 knock. Hello.
Hi.
Hi, I'm Colleen. I'm your nurse for today.
All right.
A little tight in here. So I washed my hands. I want to provide for privacy.
Sorry, I'm kind of
Oh, you're fine. Here, I brought you a snack. Here you go.
Thank you.
Yeah, you're welcome. I'm going to be administering you your insulin today, so that's why I just want to make sure you're eating. Wait, but before I give you the snack, let me make sure you're the right patient. So, can you tell me your first and last name and your date of birth?
Greg Lutz, March 8th, 1990.
Okay, that is correct, and I just verified that with the MAR, and that's all correct. Here you go.
Thanks.
You can eat as much as you want now. So Greg, today I'm going to be giving you your insulin. It's an intermediate mixed with a short-acting insulin. Do you know why you're getting this insulin today?
No, I don't.
No? Well, you have type 1 diabetes.
Okay.
So basically what that means is your pancreas, it has beta cells, and these beta cells normally they produce insulin, but yours does not.
Okay.
So what we have to do is we have to give you insulin, and what insulin does is it moves glucose into the cell, which is energy. So this gives you energy.
Okay.
Okay?
Probably makes me feel better.
Yeah, definitely. Right now your glucose is ranging a little high. It's at a level of about 242. So we want to that's why we're giving you insulin.
Okay.
Okay?
Sounds good.
All right. Just going to put on my gloves. Here, and let me just check your allergies band as well. Do you have any allergies at all?
No.
No? Okay. Yep. It says on the MAR you don't have any allergies, so that is good. Good to go with that. So I'm just going to scan your wristband. Okay, and then I'm going to scan my medication. Okay, and it's scanned. All right. So now I'm going to do my third check while I'm in here. So I have my medication is MPH, regular insulin 50/50, Humulin 50/50. I have the correct patient, Greg Lutz. I have the right amount, which is 20 units, the right time at 2100. Don't have a watch. There's a watch on here. There we go, 2100. And the route is going to be in, oh, yeah, I wanted to ask you, where was the last time you had your insulin given?
My stomach.
Your stomach? Okay, where, was it just the one time?
Oh,
Let me go turn the lights
I
on.
hate that it does that.
Ouch. Were you just given insulin the one time there?
Yeah, I've only had it once.
Once there?
Yeah.
Okay. So I'm going to give you insulin again there. I'm going to make sure it's 1 inch away from your belly button.
Okay.
And then I'm just going to give it a little further away from the last place that you had it.
Okay.
Okay? Normally you can give insulin about a week in the same spot, but it's really important to rotate injection sites.
Mm-hmm.
And so like you can give insulin for a week in your stomach, but then I would switch to your arm.
Okay.
Okay?
Mm-hmm.
And basically what this does is it prevents lipodystrophy, and this is fat like kind of accumulating in that area.
Mm-hmm.
And then if you're going to give yourself insulin, it's not going to absorb correctly, and so that can lead to like hyperglycemia, which when your glucose gets too high. So we don't want that. So that's why it's really important to rotate injection sites.
Okay.
Okay. So I'm going to be administering this in your abdomen.
Okay.
So that right is route as well. And then also I checked, oh yeah, what is your pain today?
1.
Your pain is a 1? Okay.
They gave me morphine.
They gave you morphine. Where is this pain?
It's in my heel.
It's in your heel, yeah, because of your ulcer?
Yeah.
Okay. And then I checked your blood glucose before administering it, and it was at 242. Okay. So I'm just going to get an alcohol swipe. Now, do you know any signs and symptoms to look for
With what?
with this insulin, with the medication I'm giving you?
Could it make my sugars go too low?
Yeah, it could make your sugars go too low. But another thing I want you to look for is any like redness or itching at the injection site. That could be a side effect. And then also if your sugar goes too low, some signs and symptoms of that would be like cool skin, paleness, sweating, tremors, nausea. So if you feel any of those at all, please let me know. Okay? All right. So I let the alcohol wipes, dry. So now I'm going to be giving you your insulin, 20 units. I'm just going to pinch. Ready? 1, 2, 3. Okay. And then I'm going to be putting this right in the sharps container. Okay. Are you doing okay?
Yep.
Okay. Awesome.
Good.
I'm going to throw that out. I'm going to wash my hands. And then while I'm in the patient's room, I'm going to document that the site of where I put it. So I put it in the abdomen, and that the abdomen, and that the time, which is 2100. So so now that I documented that, I'm going to sign it. Okay. Okay. So I did that. I documented the site and the time. So now, can you tell me any of the signs and symptoms that I told you of low blood sugar?
I think you said pale, cool, clammy skin.
Yeah, that's very
nausea.
good. Yeah. So just let me know if you see any of those.
Okay.
And then also, something I want you to do you keep like an ID band or like an identification card in your wallet at all?
Yeah, I do.
Okay, that's really important, so that's good. It's a card that identifies that you have diabetes. And then whenever you go out exercising or something like that, I want you to keep 15 grams of a carb with you, like a hard candy or orange juice or something like that, in case if your blood sugar gets too low, you can have that.
Okay.
Okay.
I will.
Okay, awesome. And then I heard you wanted to learn a little bit more about diet. So a really good thing is to try and keep less than 7% of saturated fats in your diet. And then also try and eat more like fruits and vegetables and legumes rather than like pastries and pastas and things like that.
Okay.
Okay. So while I'm in the patient's room, I'm going to document the site, the time, everything that I taught them, everything that they taught back me, that I gave them food, that they started eating the food before I gave them the insulin. I taught them everything that I'm going to document everything that they taught back to me and that I taught them, and the time, and yeah, and that everything went good. So yeah, so I documented that. That looks good. And then I'm also going to document that I got her pain and the glucose level before administering the insulin. So are you feeling okay? All right, you're good for now. You have your call light, you have your food. Let me know if you need anything else. I'll be back in a few hours to check on you. Not a few hours, probably like 6 hours, 7 hours to check your glucose again. Okay? All right, well, have a good night. You have your call light.
Thank you.
Yeah, you're welcome. There we go. Oh, it's your turn. Thank you so much.
Thank you so much for demonstrating a safe medication administration. I just have a couple more questions for you if you don't mind.
Yeah, sure.
All right. So were there any pertinent pieces of information you reviewed before administering the client their medication?
Yeah, I made sure that I knew their glucose level before administering the medication, which was 242. I made sure all the vitals were normal range. I checked the patient's pain, what they looked like. The patient looked good. Yeah, but the big thing is I checked their glucose before.
Good. Did this information affect your decision to administer the medication?
Yes, it did, because the patient's glucose level was at 242, which is high. I decided to administer the insulin, which will help decrease the glucose level and hopefully be in that normal range that he was in about 3 weeks ago, in the 120s again.
Good. Did this information affect how you administer the medication?
Yes, because his last spot that he had, another thing with the earlier question, one thing that I wanted to check before administering the medication was where he last gave the medication. So I asked him where he last had the medication, and he said in his abdomen only once. So that's another reason. So I would want to administer it in his abdomen because he only gave it there once, so that was a good spot to not give lipodystrophy, to prevent that happening. So I gave it in the abdomen, which is the fastest rate of absorption, and then maybe a week later, I'll give it in the arm because you want to rotate injection spots.
Good. And then did this information affect how you administered it?
Yeah. Yeah.
You kind of said it.
Yeah, it was because I would want to give it in the abdomen because that was the last spot where he had it, and it's the fastest rate of absorption.
Good. All right. Thank you so much for answering all of my questions. I really feel like I understand this so much better.
Again, not a problem at all. I'm always here if you have any questions or need anything. I'm going to take some time now and document the teaching I provided to the patient and any other things I did in the patient's room. Do you want to observe me documenting as well?
Sure. I'd love to watch.
Okay.
Here.